UC Davis, one of the top health systems in the world, with more than 10,000 highly skilled employees, generating an additional 10,000 support jobs, making a $3.4 billion a year economic impact.
If you think about them as a private sector entity, well, they're a massive economic engine. If you think about them in the public sector, they're giving millions of dollars to charity care.
Well, I think you're really doing well.
UC Davis, a powerhouse in the field of healthcare, has long been known for its top-tier patient care, education, research, and community engagement.
¿Cuándo era esto? El miércoles. ¿Miércoles?
With the goal of improving lives by transforming healthcare, the faculty and staff of UC Davis have become leaders in the art, the science, and the business of advancing health and healthcare for all.
Let me just tell you, this is some of the most creative and innovative minds in the world.
Based in California's capital city, UC Davis Health System serves much of Northern California as a leading referral hospital for the toughest trauma cases, serving the community while also training tomorrow's healthcare professionals.
Why do we do tests? To determine treatment. Right, to determine treatment.
And many of those who have trained here have stayed here.
We've hired innumerable graduates of the UC Davis healthcare system. Physicians, physician's assistants, nurses. My own experience, and I know our organization, Kaiser Permanente, is that the people who've been trained and graduated from UC Davis and came to join our program have been just simply first rate.
In support of this highly trained workforce, UC Davis has built a healthcare infrastructure that connects the region through a network of cancer care, telehealth, and primary care clinics, all giving patients and providers, even in remote locations, access to some of the best health care in the world. But an institution doesn't remain a leader in the field by standing still. So UC Davis is making the investments that matter. A $450 million surgery and emergency service facility at the UC Davis Medical Center that opened in 2010. A $36 million high-speed telehealth resource center that opens later this year. And the new UC Davis Comprehensive Cancer Center.
Another word for comprehensive is world-class. Am I okay with that just for a moment? I mean, we have a world-class cancer center here in our community, and that designation is huge for Sacramento.
With $120 million, the Cancer Center will have close to 300 scientists engaged in groundbreaking research and clinical trials.
All of the schools that make up UC Davis contribute scientists to the Cancer Center.
UC Davis's service to the community has inspired generous philanthropic investments.
The Gordon and Betty Moore Foundation has committed $100 million to the University of California, Davis to found the Betty Irene Moore School of Nursing at UC Davis.
External funding has quadrupled over the past decade, surpassing last year's $200 million milestone. State and federal funding supports many of the university's nearly 1,000 scientific studies, forward-leaning projects and partnerships like genome sequencing, molecular imaging, stem cell research. Private industry and venture capitalists are also investing in UC Davis's research projects.
We're incredibly fortunate in this region to have an institution like UC Davis Health System. Economic development and diversification requires a dominant Tier 1 research university in order to be successful.
Groundbreaking research, like this recent voice box transplant that attracted worldwide news coverage.
Taking a deep breath and count for me.
1, 2, 3, 4.
You're amazing. You are absolutely amazing.
You guys are amazing.